Hello friends, myself Dr. Veena Sakardandi here with my YouTube channel, that is Dr. Veena's Academic Realm. And today I am with one of the topic from nursing research. If we think there are many questions comes in our mind, that is what is research, what is the answer for particular question, and why there is need of nursing research in the nursing profession. So today we are going to see, and this will be a first session from nursing research, and we will try to see overview of nursing research or nursing research process in short. So let us start with the topic. As we know, the nurses are globally placed. They are working excellent in different fields as an educator, as an administrator, as a clinician, and as an administrator, and main role is researcher. So there is a need of research in every field where the nurses are working. So today we are going to see overview of nursing research, that is nursing process, and how we are going to go further for the research methods, data collection, and we will see one by one what will be the steps of nursing research. So friends, first we will see overview of the nursing research process. So there are, if you see the research process, or we can say there are 5 chapters, chapter 1 to chapter 5, how we will write and what will be the sequence of this. So chapter 1, basically first point will be an introduction of the research or researchable problem or background of the study. Second, there will be need. Why there is a need of study? What is a need, or what is a requirement, present requirement or need of conducting the study? What solution we are going to find out. Then next is a problem statement or researchable problem. Next is the objective or aim of the study. What will be the objective, specific objective for the study? Then we go for the assumption. Then if assumption, when there is an exploratory study, non-experimental study. If it is experimental study, we go for hypothesis. Then next is the delimitation of the study. What will be the delimitation of the study? And conceptual framework. So this will be included in chapter 1. What about chapter 2? Next step. Chapter 2 will include review of literature. Review of literature, that means you are going to find out review. You are going to find about the fact about the studies, like previous studies, maybe last 5 years studies or literature related to that, or any unpublished material also we are going to see for the review of literature. It depends on your type of study. We are going to divide different category, under different category review of literature. So this will be about chapter 2. Okay, next will be chapter 3. Chapter 3 will be included, like first is a research approach. What is a research approach, whether quantitative or qualitative approach? Then we go for the research design. Research design need to be decided depending on the type of study that we will see later on. So research design. Then we go for the setting of the study, which will be the setting of the study, area of study where you are going to conduct the study, population, sample, sampling technique. Then we go for inclusion and exclusion criteria, that is a selection criteria for the samples. Then next, later on, we have to have a ethical consideration, ethical approval of the from the committee, ethical committee or IRC. Then we go for like validity, which will be the first step, validity by the expert, reliability, then pilot study. Then we have a sequence of developing the data collection tool, then data collection tool will be analyzed, that is that what will be the technique used for that. Then next we go for different schematic framework, like we want to have a methodology, that is chapter 3. We are going to put in particular format or schematic representation, that also we can have. Then this chapter 3 will also include the process of data collection, and then plan for further data collection, like which will be the analytical test use, statistical test use, how I am going to collect the data, what will be the procedure, permission from the authority for conducting the study. So chapter 3 is a very important chapter, which is we called methodology or method and material, where which will we include from the selection of the research approach till the end of how we are going to plan for the chapter 4. Friends, so chapter 4 will be, as we have seen, chapter 1, 2 and 3, how to write and what will be the title of particular subpoints or subcontent. So chapter 4, basically it is for the analysis. After the data collection, there will be analysis and interpretation of that particular data or information what we have collected from the samples. So here we are going to have a different section or organization of data collected material. So first there will be like a Excel sheet where we say master sheet, where we are going to put all information like demographic variables and research related numbers, or we can say the recording, everything will be in the data collection sheet or Excel sheet, we can say. Then we go for like demographic variable, analysis of demographic variable with frequency and percentage. Then we go for the analysis as per the objective, like you can use like a comparison, SD, mean, mode, depending on your study there will be a analysis, pair t-test or unpair t-test or association we see. So chapter 4 is basically collection. After the collection of the data, there will be a organization and interpretation of your finding of the study. That will be in a chapter 4. What about chapter 5? Chapter 5, that is mainly we can say discussion. Chapter 5 include discussion, conclusion, implication, recommendation and overall summary. So discussion, we are going to compare our study findings with the some of the recent similar studies as per objective. So discussion. Then there will be a conclusion. We are going to conclude what we the major finding of the study. Conclusion. Recommendation. Like for example, there will be a specific time, there will be some limitation, there will be specific criteria for the conducting the study, or something you want somebody should do, another researcher has to do this, so that is called as a recommendation. So they can refer and they can go for that particular study, that is recommendation. Implication talks about how we can imply, how we can implement our study finding in different areas like clinical areas, education area, administration area, community area, where we can implement our findings. That is, implication is divided into nursing practice or nursing education, community area, administration. So how I can implement. Next is a summary, or we can say the summary of chapter 5 or overall summary of the chapter. So this was about all chapter 1, 2, 3, 4, 5, which we can say we have to go through that same procedure, same steps, same process when we conduct the nursing research as a PG student or UG student or as a faculty also. So today this was about the overview or the different steps of conducting the research in a systematic way. So hope you understood this chapter 1 to 5, or how, what is the different aspects of conducting the study, or what is the different process steps of the conducting nursing research. So friend, if you understood the topic related to nursing research, and this was the first session, and we are going to have a mini session on the nursing research, and hope you understood this today's topic, and it was very short topic. And please make sure to like, share and subscribe this channel also, and even this topic also, and please share with your friends, which you may find helpful for your friends also, your colleagues also. Thank you for watching this video. Thank you. Take care. See you in next session. Thank you.